Jaw pain and dysfunction is a really common issue that we see in our headache and migraine patients. So could this be something that is contributing to your headaches and migraines, and what can you do about it? Hi everybody, my name is Helen and I am an osteopath here at Melbourne Headache Solutions. Today I want to talk to you all about the causes and symptoms of jaw pain, how it could possibly be related to your headaches and migraines, and what you can do to improve it. So jaw pain and dysfunction is really commonly linked to headaches and migraines. So this link is due to like a hypersensitivity in the nerves that exit either the neck, the jaw, the head. They all converge on the brainstem, and when these nerves converge, they send signals to the head and to the other areas, and they cause pain like that. So that's one way that it can cause you pain. It may also be due to your head posture. So if you're spending a lot of time sitting like this or looking down for long periods of time, you put a lot of stress through your jaw and through the back of your neck. So those sorts of postures can really cause issues. Another one that people often do is like if they have a desk job, they find themselves sitting like this. Now that kind of position also puts a lot of strain through there and a lot of strain through the back of the neck. Another thing is if you are clenching or grinding your teeth a lot, that causes these muscles here to get really tight. But also when you're clenching those muscles, you feel them at the back of your neck too, and those also contract at the same time, and that can cause headaches. So if you've got a jaw issue, or what's known as a TMJ issue, you'll usually feel the pain just in front of your ears. So people often describe a pain here. They may also feel it in their cheeks as well. In relation to headaches, they'll usually describe a pain in this area here, or sometimes like it can be a band like your typical tension type headache. Some people will say that they feel like a blocked feeling in the ears or a buzzing or roaring in the ears, so that can occur as well. The ringing in your ears is often called tinnitus, so that can also be caused by tension through the jaw. Also, people might find that they get a clicking or popping sound when they're eating their foods or they're opening their mouths really wide. Some people might describe like a tension when they're swallowing or a tension in their throat, because all of this is connected into the jaw. So the jaw pain itself can be caused by a number of things. So it can be caused by the clenching and grinding of the teeth, this is particularly common in our patients who suffer from a lot of stress and anxiety. But that doesn't mean that you can't have jaw pain without the stress and anxiety. So it can also be caused by a history of trauma, so like some kind of accidental injury to the face or the neck, like a whiplash, history of any major dental or orthodontic work, and then tension in the muscles in the face that can cause you to bite incorrectly. There's also sometimes a displacement of the disc. So the disc sits in between the skull and the jawbone, and when you're opening your mouth wide, that disc is supposed to slide, and sometimes there's issues with that as well. So for people who clench and grind their teeth, they'll usually benefit from undertaking some form of relaxation type technique. So this can be things like mindfulness and meditation, and any kind of stress reducing kind of treatments as well. So there's things like doing regular exercise, reducing caffeine intake, breathing exercises, so working on your abdominal breathing, or doing something like a Wim Hof breathing. And also another great one is just taking a nice relaxing Epsom salt bath in the evening. And that's great for headaches and jaw pain and just general relaxation and muscle relief. So some exercises for your general jaw pain. These can include, one of my favourite ones is actually biting down on a pencil, or you can use like a chopstick. I find those takeaway chopstick packets really, really useful for this. So what you do is you get the pencil and you pop it right back into your teeth, as far back as you can, and it creates, then you bite onto it for 3 seconds, and while you're biting it, and then you release. And what that does is it creates a fulcrum, so it actually creates a gapping in your jaw, and then that releases some of the pressure for your jaw. It also helps to even out the muscles of the face as well. So you do that 10 times, and you hold each one for 3 seconds, and you do it once a day. If you've got a really overactive jaw, like you're clenching or grinding at night, or you just feel like these muscles are constantly tight, you can try something called reciprocal inhibition. So this is an exercise that when you contract the opposite muscles, it switches off those really hyperactive ones. So what we do with this one is it's a resisted mouth opening. So you hold it for 5 seconds and then you release, and you do it 3 times. And I'll just demonstrate it to you. So 1, 2, and then release. So that's 5 seconds and then release. And you can do that once a day. Sometimes right before you go to bed can be really useful as well. And so, yeah, repeat that one 3 times. So if ones that you can do, getting something like a bottle cap, or like, a cap from like a water bottle or a soda bottle or something. And what you do is you pop it in between your teeth, and then you're going to actually read the paper or read your favourite book, but you're reading out loud. And what this does is it activates some of the more lazy muscles, and it switches off and relaxes some of the really tight ones. So you pop it in like this. All right. Bite down, and then you just read out what you're going to read. Make sure you're sitting upright when you do it, because it'll stop you from kind of getting into these sorts of postures, which are really bad, and then you end up working the wrong muscles. So there's one more exercise that you can do. So it's a throat exercise. So what you do is it's almost like you are going to yawn. So imagine that you're going to yawn, and you feel that kind of popping sensation in your ears. Well, that's actually a kind of gapping in your joint. So and you also opens up these front throat muscles as well. So yeah, so you take the time to imagine that you're yawning. You begin to yawn, so you act like you're about to by inhaling a deep gasp. You don't have to open your mouth super wide, so it's more the throat that we want to open. So you just feel it opening up, and you feel it relax as you sort of do your yawn initiation. You almost imagine that you've got a big orange in the back of your throat. So that's another really great one for relaxing some of those muscles of the jaw. So if any of this sounded interesting to you, and you want to find more out about how headaches and migraines and jaw pain can be all interrelated, and how we can help you with your headaches and migraines, then get in touch with us, drop us a line below, or you can give us a call at Melbourne Headache Solutions. Okay, bye.